David Liew here for Room Now from ACR 22. I'm all for challenging ideas that get taught, and I'd really like to go back to two things related to temporal arteries and giant cell arteritis. So the first thing stems from some data from Carlo Salvarini's group about physical examination of temporal arteries. I think often people aren't sure what they're looking for, especially generalists, but sometimes us. We're not sure what we're looking for when we examine temporal arteries. What should we be looking for? Should we be looking at tenderness, thickening, reduced or loss of pulse? Well, what Carlo Salvarini's group has presented at this meeting is data looking at the performance of all three of these different things compared to halo on ultrasound as well, in terms of predicting a positive temporal artery biopsy. The long and the short of it is, tenderness of the temporal artery is basically as good as tossing a coin. Not much better than that. Whereas losing pulse, reduced pulse, or thickening of the temporal artery, that rope-like temporal artery, those things actually give value, nearly as much value as the ultrasound halo sign. So I think that gives us enormous insight into what we should be looking for. Another quick thing that often doesn't get challenged is the idea that with a full temporal artery, if you get a negative biopsy, it's because we just haven't taken enough slices, that we haven't got we've got a skip lesion, that we've hit a skip lesion, and we've got between the different actual active parts of the temporal artery, and if we just took more slices, that would find the actual lesion. Well, I'm not sure if that's the case after seeing this work from Oregon. Really lovely work looking at RNA-seq of temporal arteries, looking at places where the biopsy is positive, looking at skip lesions, so between the different positive biopsy sites, and then also looking at biopsy negative GCA as well, and comparing the RNA-seq between those three. Fascinating to see that the skip lesions and the positive temporal artery biopsies are very similar on RNA-seq, but the biopsy negative GCA is something very different. And I think that speaks to the idea that maybe we're looking at multiple different diseases under the one umbrella. For plenty more about vasculitis, everything at ACR 22 as well, head on down to roomnow.com.